Hi, everyone. Welcome to the Beauty Outlaws podcast. Today, I'm excited to bring to you a physician's assistant right here from California, Temecula, California, and we're going to discuss all things beauty with her and what it's like to be an entrepreneur and own a med spa and this wild, wild west of aesthetics. Hope you guys enjoyed this video today, and don't forget to like and subscribe to this channel so we can keep bringing you more valuable information about the aesthetic industry. Welcome to the show, Kayla. I'm so excited to have you here today. And you are a physician's assistant.
Yes.
In the world of aesthetics.
Physician associate now.
Oh, I love that.
That's new.
Is that new?
That is new.
Oh, share that with me. That's so interesting.
I think a lot of people were complaining about the terminology and also patients being confused that we were assistant to the physician when really we work in tandem with them. So they changed it. So
I like that.
Yeah.
I'm physician's associate.
Yes.
I think that is much more valuable.
And I think people understand it a little better.
Yeah, for sure. So, Kayla, you are an entrepreneur.
I am.
And you didn't start out like that. So if you could tell us your journey briefly of how you started, what got you into this, what got you into medicine to begin with.
Well, I always kind of loved medicine and knew I was going to get involved in it, but I went the natural path that my family went on, which was business. So I actually got a business degree, but I also had a pathophysiology undergrad degree as well. And I couldn't make up my mind. And then I decided, you know what, the best route after doing some shadowing and experience with other physicians was being a PA. And I applied. Thankfully, I got in. I went to Western in Pomona and fell in love with it. So afterwards, I went into originally internal medicine, did not enjoy it. We did a lot of derm at the internal medicine office. That's what got me started on Botox. And then I wanted to do more procedures, and emergency medicine was an easy pathway for me. So I started emergency med.
I have a quick question.
Yeah.
Going into derm, doing a little bit of Botox, how was that? Because you were doing probably a lot of standard assessments, right, for melanomas and different skin cancers, right? So how did you guys transition that in your practice there?
Well, I was also working derm at a derm clinic, and it was a lot of skincare checks. So it was a lot of liquid nitrogen, skincare checks, checking free cancers, and not a whole lot of procedures. Internal medicine, believe it or not, a lot of that clientele and loved Botox. And if they could come in to their regular scheduled appointment and get some Botox at the end, they were stoked and happy to do it. So.
Oh, I always wondered how they tried to transition and cross over to more of a cash pay industry when you're dealing with insurance, because that's been a struggle, I think, for a lot of providers. So you were in derm, and then what else did you do?
So again, derm, internal med, and then I got a call that they were opening up an emergency room in a small town in California. I was living in Arizona at the time, and it was Temecula, California, which is where I'm originally from. So it was kind of a calling. My husband's job was transferring him out to Orange County, Costa Mesa area.
Wow.
So we moved out here. We made the move. And I still was doing Botox on the side for friends and family, probably what you should not be doing.
Always Botox on the side.
I was, because personally I wanted it. And then I met my business partner in the ER. He became a brother to me and a really good friend. And it was just a natural transition for us to kind of start.
Wow. So when did you open?
So we opened in 2018.
Okay. So pre-COVID.
Pre-COVID.
Okay, so you didn't get a lot of time to settle your feet before COVID hit, or did you? When you had a couple years,
we had a couple years. I think we kind of hit the ground running. It kind of fell in our lap. A friend of ours was like, "Hey, I'm always in." He was a GI doctor, and he's like, "I'm always in the operating room. If you want to use my office, go for it." And I was like, okay, fine, use the office. Now, mind you, I'd already done a couple years of training, and I've did all the training and shadowing I could possibly do. I didn't want to just jump in with both feet, not knowing what I was doing. So we started in his office, and then it kind of blew up and took off. And then I took over a sublease of another friend, and then we stayed there, and it just kept growing. And yeah.
So you did start with humble beginnings.
Yeah.
A good foundation, a
Yes.
good educational background.
Yeah.
I love that. I love that you did it on the side. You learned a little bit. You became more educated, and you now have moved up to
Yeah.
entrepreneur.
I do think you're practicing medicine, and unfortunately in the ER we see a lot of the adverse effects that can happen when you're practicing medicine as well, and we always should be cognizant and cautious when using these medications. So I would never go into something blindly. Aesthetics is medicine, and we need to know all the adverse effects of it before we even start injecting our patients. So
On my last podcast, I talked to another PA, and she said she learned from a plastic surgeon, never get into something or do something you can't back yourself out of.
that's great.
And I think that's great too, right? That's words to live by. I love that you saw some, are you talking about complications in the ER from cosmetic procedures as well?
Absolutely.
Okay. Give it to us. Give it to us. I want to know.
I've seen everything from a chemical peel causing issues, causing actual chemical burns to the skin. And again, the provider wasn't aware of the complications that can happen from that. No, I don't believe I ever saw occlusions, just severe hematomas, things like that they weren't educated on and how to manage it, and sent them to the ER. But yeah, I saw a few, but it wasn't just aesthetics. It's any field of medicine.
Any field.
Yeah.
What about laser? Did you see a lot of laser?
I didn't see a lot of
issues?
laser issues actually, which is surprising.
It is
now that I'm
surprising because
into
we're
it
told
now.
that is probably one of the number one procedures that can cause the most risk or complication. So that gave you a really, really good appreciation for getting into aesthetics, right? It wasn't just fun and easy money. There was actually a lot of education behind it.
I think that hits the nail on the head. Is a lot of people think that they're going to aesthetics to have this fun, like easy money kind of gig, and it's not at all, not even a little bit. So it gave me an appreciation that there can be adverse effects, and to know what I'm doing before I even jump in that chair. So, and that's where I think I really thrived, was I took the opportunities to shadow a lot of other practitioners who were already doing it, and to take a lot of classes and courses to kind of teach me what I'm doing before I even jumped in that chair.
I love that. Okay, so we've hit complications. What I want to know is how you launched a business in this world of social media. And marketing is so different than when I started 20, 30 years ago, right? When we just did an advertisement in the newspaper to get people in. Did you hire a firm to help you guys, or did you just do it grassroots?
We did it grassroots originally. Now we do have a firm helping us. So if you know me, you know I hate social media. I'm surprised I'm sitting here because I do not like being on camera even. I usually make my staff do all the social media stuff. But it's necessary, especially in today's industry. We've been around a long time, and I like to let my treatments speak for themselves and word of mouth speak for themselves, but unfortunately you got to jump on that social media bandwagon. And having somebody help you do that is super important, and it's actually really nice. However, it's very expensive. There's been a few times I've used other companies in the past, and I thought they were going to be great for marketing, and I felt like they just took my money and ran kind of thing. So you got to really investigate who you're using, get good referrals. And now I finally feel like I have a good marketing team behind me.
What about like the law, regulatory issues? Did you guys get the advice of an attorney when you opened? Did you feel that?
Absolutely.
Okay,
Yeah.
so you did do that.
Yeah, we hired an attorney. We made sure everything was copacetic and legal, and we made sure to do it the right way. So yes, it is an upfront cost, but it gives you peace of mind.
It gives you peace of mind. It's the smart thing to do, right? 'Cause
Yeah.
then you can implement your protocols and have everything in place. I do know, because I stalked you a little bit, that you have several PAs that work for you.
Yes.
So it's kind of like us nurses. We just know nurses, right? So
Yes.
that's kind of our world. We
Yeah.
MPs, nurses. You have a group of physician's assistants
Yep.
that work with you, and do you guys all do a little bit different procedures, or?
I think everybody has their niche and like what they feel they do best. We all do the same thing. I have personally trained everyone. We have monthly trainings in office that I require everyone to take as well. I'm always learning, they're always learning, but some people love a certain treatment more than others. So I prefer to do filler. It's what I love. I'm good at it. If I could do filler all day, I would be a happy girl. Our other PA, Courtney, she likes to do BioT hormone replacement therapy and neuromodulators. Our other PA, Shanna, she will do PDO threads all day if she could. That is her jam. And then PA Christopher, he loves everything. So
I love that you've given a place for people to stay in their lane
yeah.
and be really good at something instead of spread too thin where you can't focus on really what you're talented at, because that in turn makes the patient a successful relationship with the patient, right?
Yeah.
Your business partner, is he silent partner, or is he work in the field?
He's in clinic. He doesn't really like the aesthetic side as much as the BioT hormone replacement therapy, so that's what the kind of lane he stays in. So we're going to talk about you and filler, but let's talk about hormone replacement therapy, because this is something else that I feel is part of the wild, wild west. We've got people out there prescribing and doing pellets in people that they have no business really doing this. I've seen a lot of complications actually from that, people that aren't managed correctly. So how do you guys go about that? You said you use BioT, which is a very awesome company. yeah,
right?
so BioT kind of takes the difficult part of prescribing out of it for you. So there's a lot of clinics, unfortunately, that will give somebody testosterone before even checking their labs, which is unheard of and crazy. You got to make sure their hemoglobin, their hematocrit's fine. You got to make sure they're not at risk for a blood clot. You can give somebody a stroke or a heart attack with these medications if they're not treated appropriately. However, with BioT, it is a slow delay release of the testosterone. You check their blood work, you do the pellets, you check their blood work again, and then they're in the office getting annual labs and then the pellets every 3 to 4 months, and men every 6 months.
Okay, so men. I know men are very, they're not an area of aesthetics that we talk about a lot, but they're really seeking this world of hormone therapy as well as women, because they have the same issues with aging. Even, do you guys have a big clientele there serve the male population a lot with hormone therapy?
It's growing. I think that it's definitely becoming a market that we need to explore more. When men start feeling better and the testosterone hits and they're having the energy and their skin looks better because they have more oil production and they're just feeling better in general, they end up wanting Botox and fillers and things like that just to kind of keep up with their spouse and keep up with, their looks, how they feel on the inside. So I believe that hormones, unfortunately, we're just told we need to feel crummy and this is just part of aging and deal with it, when really there are safe alternatives out there like BioT hormone replacement therapy to make you feel better. So why not?
Yeah, why not?
Enjoy your life.
Well, and there's a lot of stereotyping, especially with the male population. If you take testosterone, it's because you can't have an erection, right? That's not true. There's a lot of reasons why we need testosterone, and fatigue.
Absolutely. Mental clarity, fatigue. It's shown to prevent osteoporosis. It's shown to prevent the delay of dementia. It's shown to prevent heart disease. There's so many benefits to testosterone. And yeah, it does improve your sexual health. Why not?
Why not?
And just the energy alone and feeling better, we have literally seen it save marriages, and that is no joke. So I'm a huge proponent of hormone replacement therapy done the right way, of course.
You hear that, guys? Go check it out. I think it's awesome. I think men are an underserved population in this world. Women, we've taken us years, but now we're talking about it, right? We're not afraid to have the conversation about menopause and hot flashes and other things like that. But I think the male population struggles with that a little bit more. So go out there and get your blood work checked.
And
I love
honestly,
that.
it's always the wife first that comes in.
It is.
And I always warn them, you're going to want to tell your husband about this because they have to keep up with you. And then I'll see their husband right after. And it works like that every time.
And then they end up getting the Botox.
Oh,
and
totally.
Yeah, absolutely. It's just, it's a snowball effect.
It
I love
is.
it. I love it. Okay, now back to filler and what you love to do. Do you have a certain, because I can talk brands. I don't think it's a big deal if we talk brands. Do you have like a recipe kit of brands, or do you have particular ones you like most?
I like them all. And I know that's going to probably kill you because I know you're anti-Vicross technology.
I'm not anti completely.
But I do, it depends on the patient and what it's for. I do carry Restylane, I do carry Juvederm, and I love RHA in certain areas, but I only like certain of the RHA fillers. It just depends on what area they need, but I do love them all.
I look at your comment you just made, and that's what I think is going to stand you apart from others, because you actually have your own tool shed of different things for different people for different reasons. You understand the technology behind each one, what face is best for them when you do your assessment. I love that, because not all one thing is good for everyone.
But it's not always good from a business perspective either. So when you're running a business, just know, but at the end of the day, I have to sleep at night and I want the best outcome for the patient. And I would rather make a little less money to have a better outcome for my patients. So
what Kayla's talking about is the loyalty that you have to form with a pharmaceutical company. I mean, they do hijack you. They give you the better deals if you order from them in volume. And it's just part of the business. I personally am the same way. I use different brands, especially with neuromodulators and everything that I do. So I agree with you that, do you hear that, Big Pharma? I'm looking for a deal. Kayla's looking for a deal. We love your products.
My reps are like, shh.
I know, they're like, can you keep your mouth shut? It's a dog-eat-dog industry, and I don't blame them either. They're running a business like we are, right?
Absolutely.
So we're gonna try. We're gonna try. What is the biggest hurdle of having your own business, where you lay your head at night on the bed and you almost want to beat it against the wall?
Oh my gosh. There's so many things. So I think the biggest hurdle is people management skills. Mm-hmm. Everybody's got a different opinion on everything, especially how to run your business. And trust me, I've been working this for a long time. I came from a family that owned and operated their own business. I know how it works, and I'm always open to feedback, but you will always get somebody who thinks they can do it a little better than you, and that's fine. Just stick to your guns and protect yourself at all costs is at the end of the day.
Yes. What about turnover? Have you had a time with that, or just a little bit?
Oh, knock on wood. I have a great team. They are awesome. My little family. But not to say that I haven't had any complications in the past. I definitely have. But overall, I've got a pretty solid team. So,
well, what do you think you do that's different? What do you think you do in management, or do you answer it? What do you do different to keep people happy and have a good team? Because team is important.
Well, I think my ER background comes into play with that, because in the ER it's do or die kind of an attitude, and we all work as a family. And I think I keep that same perspective in our clinic. We're a family. We're here to cover each other. It's not a competitive environment. We're just here to make sure the patient has a good outcome. We have a lot of social outings together. I mean, I really do care about every one of them, like they are family. So, and I think that conveys and shows through, and we have a good time.
I love that. I love that. And that is true. Sometimes as business owners, we're afraid to let that guard down, because it puts us a little bit at risk for being hurt, I think.
And that's happened to me. Absolutely. Yeah, that has happened to me, but I can't let it ruin me. So that's on them, not on me. And I know I will be just fine at the end of the day. But overall, I'm really happy, and I do care and love about them so much. So,
That's great.
Yeah.
That's great. That's really important. What about other services? Do you offer skincare services? Do you have an esthetician, right?
Yep, we have an esthetician. We're actually looking to hire another esthetician, so
Yeah.
you know anyone.
Temecula, California.
We do hydrofacial, chemical peels,
Okay.
all the aesthetic services, body contouring, Beauty Hormone, IV therapy. And that's pretty much the gist of it. We are a SkinCeuticals flagship, so we use
Okay.
mostly SkinCeuticals products. Love their line, and yeah.
So, okay. So, because I stalked you. Mm-hmm. So, I'm interested to know because my world is all skincare.
Yep.
That's what I focus on. That's my specialty. I have my own product line.
Yep.
What made you set yours aside and go with a big company?
I did not set it completely aside.
Okay.
I'm still keeping some things that I absolutely love. Like I do believe I have a better retinol. I use the glycol that we use in the derm clinic that they don't have. There are certain things they don't have that I love personally. But I can't beat their antioxidants. They have got the best antioxidants I've ever used. And there's a reason why they're number one in the world for their vitamin C serum. And so it's hard to pass that. And then as far as some of their other serums, they're just amazing. Their combination, I think they have the best serums on the market. I really do.
So we just did a complete infomercial for.
I know, and
it's
I
okay
hate
because
to
it's
do
what
that.
you love, and so many people do love that.
Yeah.
Can you please explain to the viewers what a flagship is considered?
So a flagship is like a retail location. They usually do dermatology clinics, but they have some med spas as well. They choose 150 clinics over the nation to be a flagship for them. They do require a lot of training behind that, which is great because I'm all about the training anyway. And yeah.
Support.
Yeah.
I feel like just talking and getting to know you that you'll commit to a good product or good company as long as they give you some commitment back and they're investing in you and your business.
Absolutely.
With the support, right?
I think you have to have a lot of support, but I also think with skincare, it's important that you see results. So the thing I liked about SkinCeuticals that almost all the other skincare lines don't do is they do an 8-week study of every skincare line, punch biopsy the skin, and make sure there's actual visible results to be seen. And if they don't carry it. So that's kind of an amazing feature that they offer that you can say, hey, this is truly backed by science.
That's great.
Yeah.
That's great. And you said it yourself, you like to do, you want to be in your room doing filler all day.
I do.
So skincare is not, you love it, but you're going to leave it to the specialist for
Skincare
it.
is actually my passion and what got me into this. So I do know a lot about ingredients and what to use and what not to use and don't combine this with that. And that's actually what got me into aesthetics because my mom loves skincare. And I was that person that fell for every marketing brand, La Mer, La Prairie. I mean, I purchased all those.
some
And
old
then
names, I love it.
when I found out they weren't working and they weren't doing what they were supposed to do, I cried because I just spent like $550 on a face cream that did nothing for me. But that's the same thing with aesthetics. You got to trust your provider that they know what they're doing, that they're going to see results. And, same thing with skincare. So
Absolutely.
I love it all, but yeah.
You love it all.
I do.
But you have, everybody has their niche, right?
Yes.
But what's great is that you can assist in skincare at home for your patients as you're volumizing them and enhancing them under the skin.
Absolutely.
Then you can send them home with some products that actually work.
Oh, it murders me when I'm doing Botox and Dysport or NeoMed and they're not on a retinol or, they don't wash their face at night.
I know.
Yeah.
I've noticed skincare has become quite popular again recently. It's trending
I know.
a lot. Since that's my industry, I'm really noticing it. It's really taking an uptake. I'm not quite sure what that's all about. I have my suspicions. What do you think it's all about?
With
skincare, with skincare being more promoted.
TikTok.
It's TikTok.
It's TikTok. And believe it or not, I'm not part of TikTok, but my own father, who doesn't know anything at all, will send me stuff on TikTok. Do you guys carry this at your clinic? I'm like, no, I don't carry that at all. But I feel like it's social media and people are scrolling and they're at home and they're checking, and there's so many filters out there that it just kills me.
I know the filters. The filters are insane.
I know.
Okay, let's talk a little bit about regenerative medicine.
Yes.
Do you do any of that in your clinic?
Besides the hormone therapy, we do like some type of injections for IVs, like glutathione, things like that.
Okay.
But no, I don't really do that. That is a whole nother arena of medicine that would just take up too much of my time.
Yeah.
Not to say I don't want to do it in the future. We do the GLP-1s, which, again, make sure you're going to semaglutide. Make sure you're going to a licensed provider to do these things, and you're getting all your lab work done. Super important. But no, I kind of keep that to their own, providers that really dedicate their time and research to it.
What about PRF? PRP.
Yeah, we do. We have done that for years. We've been doing some exosomes as well. I know you're huge on the PRF. And I do think it's extremely important, actually. I think you should be doing PRF in your under eyes before you even start attempting filler in the under eye. I think that it's super important to use your own body's growth factors and collagen stimulators. Mm-hmm. Before you start.
A little bit of everything,
right? A little bit of everything. It blends together.
It does.
It's important that when you're getting filler, you're not looking artificial or fake. You should just be enhancing the natural beauty you have. You shouldn't see it on animation. You should just look more refreshed but still looking like you. And I think PRF is a huge game changer for that. Yeah. Same with Sculptra too.
Sculptra, the biostimulators, Radius is considered a biostimulator, although I would argue with that. That's just my argument to myself.
Mine too, a little bit, so I feel you there.
But me, I've dabbled in the litter box everywhere.
Yes.
And I've done it all. I've tried it all. And there's a place for filler. There's a place, you need it all. You need the PRF, you need skin regenerative. But there's also people that can't have or are afraid to do procedures like filler, and they have opportunity to move into PRF.
I think it's a great tool to have, and we do a lot of Morpheus, and kind of similar thing. It stimulates, your own collagen production. It helps with skin resurfacing. I think that's been huge in our practice. But again, it's the provider using the machine and knowing what they're doing, because I've seen a lot of poor outcomes of Morpheus where they were at the wrong settings, wrong frequency. They caused fat atrophy. They caused PIH. They caused all sorts of issues just because they don't know how to operate it.
Yep.
Yeah.
I've seen a lot of that too.
I think I heard a doctor on one of the podcasts, and I'm going to mess this up, but he said, you're driving a Ferrari, you better know how to drive it. And it's true.
It's true. Speaking of radio frequency, that procedure has changed quite a bit, right? Morpheus, they were the first in their world, right, of radio frequency?
Yeah, so I think they actually came out, and don't quote me on this, but around 2011, but they were in plastic surgeons' offices only, and so they would use it post-procedure after a facelift or tummy tuck just to kind of resurface the top of the skin to even everything out.
To give less trauma than, say, a CO2 would do.
Exactly.
Right?
Yeah, and then the outcomes were better for the surgeon, right, because their skin looked good, and then their skin was tight, so beautiful. And then in 2018 or 2019, I think it was just before COVID, they released it to market. Now, I had known somebody who had it before, a plastic surgeon. He was like, when this machine comes to market, you should get it. And so I kind of jumped on it right away, and thank goodness I did, because it worked out beautifully. So
that's great.
Yeah.
That's great. So you get success in your practice with it, and that's good because it's in the hands of somebody that knows how to perform it. And also, it may not be for all patients, right? You just filled someone's face with $5,000 worth of filler to enhance their beauty and give them volumization. That may not be your choice, but it's up to you as the provider.
Yeah, it's up to you. I mean, there's a lot of, some people agree or not that it may break down the filler. Again, I think it has to do with the settings, but this is why skincare is so important, because if somebody is a higher Fitzpatrick, you need to prep their skin. You don't want to do a lot of energy with some radiofrequency microneedling on their face and then cause PIH and all sorts of issues. So you want to prep them. We have a hydroquinone compound that we do in office. We also require them to start on a skin nectar serum just to promote healing. But there's prep involved. It's not just, hey, come in the office, we're going to Morpheus you that day.
I love that. I love that. So what do you think is the biggest scam in our industry?
The biggest scam.
Let's say the biggest scam towards providers. Do you feel like there's one out there right now? Do you see anything that's kind of coming across your feed or walking in your office trying to promote anything? Is there anything that you're kind of thinking this isn't?
Oh, that's hard to say. That is so hard to say. I guess I'd have to think on that one more. I mean, there's always somebody trying to sell you something new and the best of the best. But I don't know if I've ever really been scammed.
It's hard when you feel like you haven't been scammed. I asked the last person I interviewed, Danielle, what she thought the biggest scam was, and I'm just going to throw it out there for you. I'm going to tell you what she said. She said she believes it's in education.
In what?
In education. The new educational platforms, the money grab for training.
Absolutely. Yeah.
And I thought she hit the nail on the head with that because it's so true.
Well, I think that there's some places that provide an excellent education platform. Actually, where I met you at Gideon's place, Dr.
Yes.
Clark, I did a training at his office. He was fabulous. However, I did another training at somebody else's office, and I did not get my money's worth. And that, unfortunately, is hit or miss in this industry. Some people will charge, $1,000. Some people will charge $15,000. It gets... I think that's the wild, wild west.
That is.
Yeah.
And that's what we're seeing. And then they're coming out, you spend $15,000 on a 4-day, or they call it a 2-week course that's 3-day weekends. And then you're just sent out with no experience. Nobody's going to hire you except for, I won't mention these names because I'm just going to keep my mouth quiet on this one. But there are chains.
I know the chains.
You do? Derm Fix.
Yeah.
Derm Effects.
Yeah. Naked MD, that's another one.
I mean, we're mentioning them. Guns blazing. They are okay with being the Walmart of aesthetics. They are okay with that. That is their business model. So it gives, I guess, these young girls upcoming a place to start so they can get experience.
I was told that I should be thankful for their business platform because it'll give me an experienced injector for when I need it, was a response I got for that. But I mean, you got to get your experience from somewhere, I guess, right? I mean, we had to start somewhere as well. And I think as a new injector, you don't know where to go. You don't know, there's no, like for me going to PA school, you apply to these programs, you have to have these prerequisites to apply. You would get interviewed, then you go to school, then for ER, you do a 1-year residency. So there's certain things that you have to do. But in aesthetics, it's not like that. You can go get your RN or PA and be opening up your own business the next day if you wanted to. So there needs to be some sort of regulation on those kind of things.
That's what I want to talk about is regulations and accreditations. And I think you do. I was going to ask you, do you feel like we're going to have to regulate ourselves before we get regulated?
Absolutely. I think we have to. I mean, I still feel like I'm learning every day, and I've been doing this for many years, but I mean, you've been doing it 3 times as long as I have. But seriously, I think it's a never-ending process. You're always learning, but we got to abide by the same guidelines that we're asking of everyone else too. But it also gets really hard managing a lot of issues that I'm seeing out there for other people and not speaking up.
Right.
There's no protocol for that. So
There isn't.
Yeah.
There isn't. And I know a lot of people, I've just recently encountered a complication, and I've learned that sometimes I see why now people don't want to take them on. Someone else's issue. because you could end up spending thousands of dollars taking care of them.
Absolutely.
And you want to because your heart bleeds and melts for it. But we have got to come up with some sort of roundtable or some sort of regulations or training. And I mentioned this in the last podcast that Lori Robinson and Aesthetic Immersion is trying to have a high-level educational system, and they do have it.
Mm-hmm.
They are making it happen. But we also are going to need, I think at least in California, I think it's time to get some like certificates that are like a shadowing mentorship program or something. We need something.
There should be clinical hours that they require for them to receive some sort of certification in aesthetic medicine. And I would hope that all of us, RNs, PAs, MDs, come together and don't try and segregate it too, because I know there's also some MDs that just want MDs doing it. There are PAs that just want PAs and RNs. We need to be
come together.
Come together, yes.
Because it's really not about that license. It's what happens after, right?
Absolutely.
Because we all have the foundation.
Yes.
We're in the foundation of medicine. We've all had assessment training. We all know hopefully how to handle a vasovagal or something like that. Although a lot of people don't. I will say that a lot of people don't.
You can vasovagal on me anytime.
Can I?
I got you.
So I that's the one goal I have with this communication here is opening up, bringing us all together, PAs, NPs, nurses, doctors, plastic surgeons, and actually Suzanne talks about it in an earlier podcast about the differences between cosmetic surgeons and plastic surgeons. Yeah. They look at each other as they don't deserve to do this, a plastic surgeon, because they have all these years of experience. So we need to come together, and I'm hoping I can be helpful in this bridge of this gap between the PA and the nurse, because we are all deserving of this space. Mm-hmm. We just need to be, we need to honor it. And it takes time and education.
And it just doesn't come on our shoulders. I put a lot of blame, and I'm so sorry, but the pharmaceutical companies for giving putting these medications and these implants and these devices into providers' hands that don't have the experience behind it. There needs to be some liability there. And I don't know about you, but my insurance has gone up tremendously over the last 8 years. I used to pay a lot less for my malpractice than I do now. Knock on wood, I've never had a lawsuit, but it doesn't matter. The market has been saturated. There's a lot of inexperienced providers out there, and a lot of complications are happening, and in turn it goes to all of us. So yeah, it's everybody.
And what does the certification mean that we have to send the insurance company? It could mean nothing. You could print your own certification on a piece of paper and send it to your insurance company, and they will accept it.
Yeah,
that's the wild, wild west. So that's what we're dealing with.
Yeah, it really is wild. I mean, it's seriously, there needs to be just more accountability and more training. And the market is saturated with a lot of medical spas, and I hopefully patients take the time to educate themselves on who's treating them, because there's a lot of risks that we talk about that already, but there's a lot of stuff that can happen, and you need to trust your injector. And I hope that all my patients trust me, and I hope that I trust myself in whatever procedure that I'm doing, and I have the knowledge and background in it before I even touch that patient. So
they get that from you, and they know. And also, some things I tell my patients is when you're in the room at another provider's office, don't have them. They need to be drawing your product up in front of you. Don't take something from the back. They walk in from the back room, and be okay with asking for the box or the insert or getting that informed consent. Be okay with that, or walk out of the room.
It's funny. I do not bring it in the room, actually.
You do? Okay.
I have a lab in the back, and the reason why is so many patients, and I don't mind bringing in the room drawn up. I do all my mixing the morning of, and I have no issue with bringing it in, but anxiety is real with patients.
It's true.
And
there are
they
some patients
see you drawing that up, and sometimes they'll freak out, so I just take that out. But if they want me to draw up
or
in
just
the office,
have
I'm happy to do it.
Not even draw it up. Like I don't mix my neuromodulator in front of the patient unless I need to.
Yeah.
But access to the actual box.
Oh, yeah.
The actual vials you're using, things like that. I mean, some places backfill syringes, and that's okay too. But like you said, it comes down to knowing. Well, they say it's risk of infection.
I am not a fan of backfilling a syringe. That kills me. I don't do it. Use the syringe as it's dispensed. There's no way to be sterile in backfilling a syringe, but that's a whole nother topic.
That's a whole nother topic that some of you are listening that don't understand. But that's when you can take a syringe and a filler that's been made by the factory, by the pharmaceutical with high standards. You're not going to get you're not going to have less risk of infection with those standards. And then you open up the back of a tuberculin syringe and you squeeze it in and you inject it from those needles because they're tinier, right? A lot of people want to use them because they're tinier and less painful.
Yeah, which I can understand the less painful part of the thing. I've seen or heard that people will even save those syringes for patients, for touch-ups, and you're just putting yourself at risk and the patient at risk for infection.
The patient.
Yeah, it's not worth it. It's not worth it.
Poking holes through the acid mantle of somebody's skin, that's their barrier of protection.
Absolutely.
You need to make sure what you're using is sanitary and sterile, actually sterile.
Yes, agreed.
Or wiping this gauze. I see a lot of that wiping and training, like taking with Sculptra or with filler, taking a gauze 4x4 and using it to wipe the tip of the needle as you're.
I just watched a training video on YouTube, and he was using a cannula, and he takes an alcohol swab and wipes the cannula, and I was like, oh, no. Like, please don't do that. So, yeah, don't touch your needles.
Don't touch your needles or your cannulas. And cannulas are expensive, so that's the scary part is people try to work around that, right?
Yes.
Because they're like $7 a cannula or $10. They can be expensive.
I love a cannula, though.
The cannulas are great.
Yes.
Cannulas are great. So, okay. So we're going to wrap it up because we could talk like forever together. One last question, and I ask this to everybody.
Okay.
Do you aspirate or do you not aspirate?
I do aspirate. I think safety is utmost importance, and if that gives me one more piece of security, then I'll do it. However, I have the most still hand you've ever seen. I do not shake or move my needle when I aspirate. I'm very good at that. I'm very good with my hands. If you are the type of person who shakes or moves around a lot, don't waste your time aspirating. But if you can keep it still and do a good aspiration, yes. And then I also take extra security measures, like if I'm doing piriform aperture, I do inject a little Lido with epi in that area before I inject. So,
do you do nose filler?
No, absolutely not. Okay. 33% of blindness cases come from nose filler, and the rest comes from temple. So I don't play that game. A good friend of mine who's a plastic surgeon said, I need to have a plastic surgery office if that happens. I'm a big believer in that. So no.
There you go. Sounds like somebody, if you're in Temecula, it sounds like you found a pretty good provider here. She's ethical. She stands her ground. I love that. And yes, majority of blindness comes from the
liquid rhinoplasty.
Yes, the liquid. But it originally was caused, we found it originally in glabella and then also the temples.
So when I very first learned filler, I know we got to wrap up, but they were teaching us glabella and eyebrow filler. And it just kills me now because that's what I was trained on. And I'm like, I woun't touch that with a 10-foot pole now. So,
well, back in the early days, we were doing things that you just didn't know. We didn't know that this was a possibility. So if a patient is listening right now, you are putting yourself at risk, and you should be informed of this when you do a temple filler. I know that it was just FDA approved. Voluma was just FDA approved, which is an implant that is placed in the temple for volumization. Now, this is very slim chance that you would go blind. But again, you need to be able to get out of what you get yourself into.
Yes.
So in the right hands, this is an excellent and much needed volumization of the female and male face, but mainly female. It can really change and the shape of your face and make you look, more heart-shaped. It can help with that heart-shaped look. And I personally will only refer people to like an ocular plastic surgeon, like a Steve Yoland, someone like that can get himself out of something like that.
Yeah.
Doesn't mean your provider, if you've had it done, is can't handle the situation. I'm just saying we're seeing a lot of newbies come out that don't understand what they're getting themselves into. And I don't want to fall asleep at night thinking, worried all night that I could have given somebody an occlusion and they could go blind, or blindness is instant.
Yeah.
It happens.
Just make sure you have oculoplastics on call.
Yes.
And they're close.
Well, and you've got, I believe Dr. Tim Pierce did a study. You've got 60 minutes to reverse that.
Yeah.
60 minutes to reverse that blindness, or you're permanently blind.
See, we're fortunate enough. I came from ER. I'm literally directly across the street from the hospital, and I have all those guys on call because they're all my friends. So
I love it.
We are lucky in that fact, but you need to, if you're opening up your own med spa, you need to have all those people on call, on standby in case that does happen. And yeah, it's going to cost you some money, but blindness is going to probably cost you a lot more in court.
A lot more. So now that we've scared the bejesus and destroyed the big pharma company, and they've taken me off the internet.
This is a fun topic.
Watch out. Watch out. The goal, though, wrapping the whole thing up, the goal is to actually all of us come together.
Yes.
Whether it's big pharma, PAs, NPs, doctors, plastic surgeons, we owe it to the patient to come together and come up with a better way, a more uniform way of doing this.
And I hope you find that way, and I hope to be a part of that way in any way I can help out, because I do think it's really important.
Great. Well, thank you so much for being here. Yay. It's great. I just love meeting you girls and finding out we have so much in common. I love it.
Yeah.
So thanks for being here, sweetie.
Yeah, of course.
And I'm going to come visit you.
Yes, please.
All right. Champagne. Woo! So at the end of every, and we do not do this, you don't do this when you inject.
Do what?
Drink champagne.
Oh, no.
Peace out, everyone. See you next time.